Good afternoon and welcome to United TV. Today is June 14, 2024. Our diabetes wellness webinar is going to start. Today we are going to talk about recent advancements in diabetes and weight management medications have introduced groundbreaking treatments and the promise to transform patient care. And we have our experts who are going to join me, Dr. Ripu Hundal from First Aid Endo, and also Caroline Weber, our dietitians, who is running the program for us. How are you guys doing?
Good.
Good afternoon.
Dr. Handal, I know you and I, it's been a while that we haven't done this together, so it's been busy. But the program is going on a regular basis, and thank you for joining us. Most people already know who you are, but well, if not, you are probably the most famous endocrinologist in the Mid-Atlantic region. So if you can just introduce yourself, and then we'll do the same with Caroline, and we'll start the presentation.
Yes, I'm Ripu Hundal. I'm one of the endocrinologists in northern part of Delaware. So I've been in practice for more than 20 years and part of the United Medical ACO program. So we are here to talk about recent indications for new diabetic medications and some weight loss medication.
Caroline?
And I'm Caroline Weber. I'm one of the dietitians on staff United Medical. I'm also taking part in helping run the diabetes and nutrition program. So we work with counseling patients on nutrition choices, education, and overall support in their diabetes journey.
Dr. Handal, did you want us to present and then we can control the mouse from our side?
Yeah, that's fine with me. Yeah.
All right. So I will make Caroline the host.
Sure. Just give me 1 second. All right. Share my screen. Okay. Can you see my screen?
Yes.
Yes.
All right. All right. You're set to go.
All right. So today I just decided to talk about these newer classes of medication which are at the forefront of treatment for type 2 diabetes. And just to clarify the importance of knowing about these medications, like what are the recent indications, because it's helpful for the patients to talk to their providers. And if you're not on these medications, then it's a good idea to talk to your providers and help yourself going on one of the medication, as long as there are no contraindications, and if your insurance covers these medication. So we have like the one class of medication called the SGLT2 inhibitors. These medication mainly works in the kidneys and helps to get rid of extra glucose in the urine. So it was initially approved for treatment of type 2 diabetes in addition to diet and exercise. Then slowly over time, a lot of other studies came, and this has been shown to be very helpful in multiple other conditions. So I've highlighted some of these few things. So the first one is saying to improve the glycemic control in adults with type 2 diabetes. So the dose is usually 10 milligram or 25 milligrams, so that can be adjusted accordingly. Then the other new indication is that it helps to reduce the risk of cardiovascular death in adults with type 2 diabetes and cardiovascular disease. So if someone has underlying previous history of heart attack, had bypass surgery, so this medication will be a very good medication to be on, in addition to other medication like metformin, because this medication did show that it reduced overall mortality, risk of dying by 39% in that study. Then this drug, again, in other studies have been shown to reduce the risk of cardiovascular death and hospitalization in adults with heart failure. So a lot of cardiologists are now getting on board, and they are putting their patients on Jardians if they have underlying congestive heart failure. Then the other indication for this medication is to reduce the risk of sustained decline in the renal function, which is called the estimated GFR, and stage 3 other kidney damage and prevent the further progression, cardiovascular death, and hospitalization in adults with chronic kidney disease who are at risk for progression. So as most of people may be aware that kidney damage is one of the complications of uncontrolled diabetes. So numerous studies, research are being done that how to prevent the decline of kidney damage so that these patients don't end up on dialysis. And once people are on dialysis, there is very high mortality. People don't live that long. So that's why the emphasis is how we can prevent the decline in this kidney's functions. So this Jardiance also has been shown to reduce the risk of decline in the kidney function test, in addition to the other positive things which I mentioned. So there are a lot of other conditions where Jardiance can be used, not just for control of the diabetes. And now another new thing is that this has been approved for pediatric use also. So kids over age 10 years of age with type 2 diabetes, we can introduce Jardiance in those individuals, kids as well. One important thing is it's not still approved for treatment of type 1 diabetes. We have to watch for risk of diabetic ketoacidosis. That's very, very important. It can be even a fatal condition. So people should watch for sudden onset of nausea, vomiting, severe belly pain, and immediately should get in touch with their providers. I mean, labs have to be done in order to diagnose this, or if they are feeling very sick, they should go to the emergency room. And the other more common symptoms, the side effects they can get is the genital mycotic infections. These are usually yeast infection that can happen. So if somebody is getting recurrent yeast infection, then have to come off the medication. And one important thing is the GFR, the kidney function test, which I mentioned, if it's below 30, which is stage 4 kidney damage, then at that level, it's not effective to lower the blood sugars. It is good, still good for the congestive heart failure and the kidneys issues, protective effect, unless the GFR is below 20. So next slide. So there's another one of the SGLT2 inhibitors you must have heard over the news also, TV ads. This is called Farxiga or the dapagliflozin. This is another medication which has similar type of indication for the treatment of type 2 diabetes, for treatment of their type 2 diabetes. Now, in addition, these other beneficial effects like to reduce the risk of hospitalization for heart failure in patients with type 2 diabetes and established cardiovascular disease or multiple risk factors, then to reduce the risk of cardiovascular death plus hospitalization in patients with heart failure. So similar type of indication as Jardiance, and then again, the similar type of effect in the kidneys as well. So both of the drugs have similar type of positive effects on the heart, on the kidneys, on the blood sugars. And this medication also approved for use for kids over age 10 years of age. And the contraindications, side effects are essentially similar to Jardiance. Okay, next one. This is another medication available called the Invokana or the canagliflozin. So this is approved for treatment of patients with type 2 diabetes. Then also has been shown to reduce the risk of major adverse cardiovascular events in adults with type 2 diabetes and established cardiovascular disease, and has that similar type of indication to prevent further decline in kidney function test, reduce the hospitalization for patients with heart failure, in patients with type 2 diabetes and diabetic nephropathy. So all these 3 drugs are very beneficial. Again, it boils down to what your insurance is covering. So definitely, if you're not on one of these medications, good idea to talk to your providers and see if you can go on one of them. And especially if you have indication where you have been diagnosed with chronic kidney disease related to diabetes, risk if you have underlying heart disease, congestive heart failure, patients to go to. Next one. And then there's the 4th one also in this list, Stiglatro. This medication at this time with the studies which have been done, it does not have that additional beneficial effect, but it has been approved for treatment of patients with type 2 diabetes. So again, if nothing else, if the other medications are too expensive, then maybe if this is covered, good idea to go on this medication. It won't harm you in any way. But again, the studies have not shown positive effects, unlike the other drugs. The other major class of drugs, which you see all the time, the TV ads nowadays, I mean, all these movie actors, I mean, they are going on these medications. People have reduced a lot of weight. So everybody is running after these medications. The more commonly seen on the TV ads, Ozempic, a lot of these movie stars, and they have gone on and they have reduced a lot of weight. So we hear about this all the time. So I just want to shed some light on these medications. This is called the Ozempic. So these are called GLP-1 agonists. These are the medication which works in a different way. The first class of medication works on the kidneys and helps to get rid of extra glucose in the urine. This second class, called the GLP-1 agonist, that works on another hormone called the glucagon-like peptide 1. It helps to augment the action of this hormone. So it helps to increase the insulin secretion, decrease the hormone called glucagon, which works opposite to what insulin does. It works on the appetite centers in the brain and helps to suppress the appetite, works on the stomach to slow down the stomach emptying. So in other words, when people eat, they feel full quicker and end up eating less. And then if they do more regular exercise, in addition, when people can have a substantial amount of weight loss with these class of medication. So originally this medication were approved, this class was approved to improve the glycemic control in adults with type 2 diabetes. Then subsequently other studies came, and now the other indication is to reduce the risk of major cardiovascular events like heart attacks, stroke, non-fatal heart attacks, and even, mortality, cardiovascular mortality in patients with type 2 diabetes and who have underlying heart disease. So if anybody with previous history of heart attacks, stroke, bypass surgery, poor circulation in the legs, any carotid stenosis, blockages of the arteries in the big vessels in the neck, those individuals will benefit from use of these medication. Now, one important thing with these class of medication is that someone with history of pancreatitis, that means inflammation of the pancreas, they should avoid this class of medication. And while on this medication, if you develop any consistent like nausea, vomiting, severe belly pain, then immediately stop the medication. People get severe belly pain in the middle of your stomach area, pain going to the back. That can be an indication or sign of this pancreatitis. It's a serious condition that you have to go to the emergency room. But this again is a very rare complication. And then there is another rare type of thyroid cancer called medullary thyroid cancer. Any family members with this type of history, or the patient himself or herself has previous history of medullary thyroid cancer, then that individual should not go on this class of medication. Then again, the Ozempic is not approved for treatment for type 1 diabetic patient. All of these medications are for type 2. Another important things which you must have heard in the news is, since it slows the stomach emptying, so people, if they are not careful, if somebody has underlying gastroparesis, that means slowing of the stomach emptying, then if we add this medication that can further slow the stomach emptying, that can lead to more nausea, vomiting, can cause more problems down the line. So those type of individuals with gastroparesis should avoid being on Ozempic. But in general, if you're on medication and keep on having issues with nausea, vomiting, then do not take the drug. Some people, they want to lose weight and they keep on taking the medication in spite of the stomach problems. And that's not a good idea in the long run. So this is given by subcutaneous injection under the skin. It's a once weekly injection. The minimum dose you start with 0.25 and gradually you can increase to 2 milligrams once a week. Next one. Next slide. Yeah. So the another drug in this class is called Trulicity or dulaglutide. So this is similar mechanism of action. This is also approved for treatment of patients with type 2 diabetes, then also beneficial in patients with heart disease, that it has been shown to reduce the risk of major cardiovascular events in individuals with diabetes and cardiovascular disease, or they have multiple risk factors. So similar type of side effects, watch for pancreatitis and no family history of medullary thyroid cancer. Again, not to be used in patients with type 1 diabetes. And this comes in a different dosage of 0.75, which can be gradually increased up to the maximum dose of 4.5 milligram once a week. And the similar type of caution with anyone with underlying history of gastroparesis. Next one. This is the other new drug on the market, Mounjaro. This is a medication which is combination of two effects. The previous one, as explained, that's called GLP-1 agonist. This has a dual action. It works on the GLP-1 receptors, and there is another receptor called the GIP. So it has a dual action, and with these both mechanism has a nice effect on insulin secretion, on glucagon secretion, then similar effect on the higher centers to suppress appetite, works on the stomach on a similar fashion, and helps with weight loss. So Mounjaro is approved for treatment of patients with type 2 diabetes. There are ongoing studies about the cardiovascular safety, but at this time it's indicated only for patients with type 2 diabetes to help with controlling the blood sugars. Side effects are the similar, risk for pancreatitis. Then anybody with family history of medullary thyroid cancer should not be on this medication, not to be used in patients with type 1 diabetes. So it comes in different doses. You monthly basis, you increase the dose. Minimum dose is 2.5 milligram once a week. Then it can be increased to a maximum dose of 15 milligram once a week. Again, not everybody can tolerate the highest dose. So whatever dose you can tolerate, that's the best dose for you. You should stay on that. But again, if it's causing more stomach problems, if you have underlying gastroparesis, it's getting worse, please discontinue the medication. Do not keep taking it just to make you lose weight. Next slide. So now we have a lot of emphasis on weight loss. People are going through bariatric surgeries, then we have drugs on the market. Previous drugs, weight loss medications, they were not that effective in lowering the weight. The more newer ones are much more effective. That's why you hear a lot of ads now coming on the TV. So Wegovy is one of them. It is also GLP-1 agonist. The compound, the drug in it is called semaglutide. So semaglutide is same thing what was in Ozempic. So semaglutide is marketed for treatment of type 2 diabetes under the name of Ozempic. And this is marketed as Wegovy for treatment of weight loss. So again, this is the same drugs, but named differently for their indication. So just please remember that. Some people, they come and say, oh, can I take Ozempic together with the Wegovy? These are the same drugs, but just because of the FDA indication are marketed. So just try to remember that. So this is the Wegovy currently. It is approved as an adjunct to diet and exercise for individuals who have chronic weight problems. So the current indications are if someone has BMI, body mass index, of more than 30, or if they have BMI greater than 27 in presence of other weight-related comorbid conditions like hypertension, type 2 diabetes, this mixed hyperlipidemia. So if someone has these conditions and BMI above 27, and if they have tried their best in terms of after their dietary counseling, their lifestyle changes, they are unable to lose weight, then this medication is available for use. So in addition to weight loss, just recently the company was studying this drug, and recently the study came that this is now also has been shown to reduce the risk of cardiovascular death, heart attack, and stroke in adults with cardiovascular disease who were obese or overweight. So again, not surprisingly, as I explained earlier, Ozempic also has this indication. So similar compound, now marketed as Wegovy, showed similar findings. So again, people who are overweight, obese, with heart disease, want to lose weight, this is a very good medication to be on to help improve their weight. And then obviously there's a benefit for reducing the risk of cardiovascular death. This is also approved for pediatric population, 12 years and older, where there's initial BMI at more than 95th percentile. So that by definition is obesity in kids population. So it can be used in those ones too. And again, similar contraindication, do not use in history of pancreatitis, medullary thyroid cancer. This dose is a little different in the Wegovy. The dose can be increased up to 2.4 milligram dose. Remember, in Ozempic, the maximum dose was 2 milligram. So in this study, the weight loss, I mean, the various different studies have shown anywhere from 10 to 16% body weight loss over 1 to 2 years period. Actually, the maximum study, I think, was 1 year. And again, watch for gastroparesis. And if anybody having consistent stomach issues, please stop the medication. Now, the most recent drug on the market for weight loss is called the Zepbound. So Zepbound it's the tirzepatide. This is same thing marketed as Mounjaro for treatment of type 2 diabetes. So again, remember this, Mounjaro and Zepbound are the same drugs, but just marketed differently for different indication. Mounjaro for treatment of type 2 diabetes, Zepbound for weight loss. So again, keep that in mind. We get frequent calls. If I'm on Ozempic, can I add Zepbound? Or if I'm on Mounjaro, can I switch over to Zepbound? Mounjaro and Zepbound is the same. So similar type of indication as an adjunct to diet and exercise. It can be used if the initial BMI is over 30, or if it's above 27 in presence of other weight-related conditions like type 2 diabetes, sleep apnea, cholesterol problems, cardiovascular disease. So we can use this drug. This is how it's indicated. Again, side effects are the similar, the GI side effects, history of pancreatitis, then medullary thyroid cancer, be careful. So the doses are the same as in the Mounjaro. So starting dose is 2.5 milligram once a week, for first month. Then on a monthly basis, we can keep on increasing the dose up to the maximum dose of 15 milligram once a week. And this drug has little more weight loss as compared to the Wegovy. So this one has around like 21% weight loss. But again, it will vary from person to person. So don't think these are magic drugs. You have to do your part as well. Yes, it will help to suppress the appetite, helps you to eat less, but at the same time, you have to burn those extra calories. And following your instructions from your dietitian, making sure you are on a low-calorie diet, doing your regular exercise, then you can really reap the benefits of these weight loss medication. So I think that was the last slide. So I'll stop over here now.
Thank you. Any questions that we have?
We can continue with this, and I have a couple questions at the end.
Sure. So we review the medications that are game changers for blood sugar management, and now we're just going to dive into diabetes management through nutrition. We're going to review why food is important for diabetes management, how it affects our blood sugars, which foods are essential to include, and then portion sizing and timing impacts. We'll also touch on a couple other factors that do impact our blood sugar as well. So why is food so important for diabetes management? We use food for energy, so we need food to survive. Everything we eat is broken down and used and digested, and especially with specific foods like carbs, we'll talk about that they're digested and turned into sugar, so they impact our blood sugar directly. We can see through blood sugar monitoring, right? If you eat a piece of candy and you monitor your blood sugar right after, right, you'll see the rise and you'll see it stay up in that high range, especially with anybody. But with those with diabetes, we have trouble removing that sugar from the bloodstream naturally. So there are simple changes that we can use with pairings, types of carbs, amounts of food that can help better control our blood sugar. So we see direct impacts from things like fiber and protein being added into our meals and snacks that do help slow down the digestion, which help to release the sugar slower into the bloodstream. We also know that we can't eat perfectly, and you can try your best, but there are days when we just can't. So we know that prevention is important, and food choices work well with the medication that we talked about, right? I would highly recommend if any of these medications are used, especially in the weight loss journey, that you speak with a dietitian, because your nutrition needs are changing, right? Your protein needs are elevated under these medications because we don't want you to lose muscle mass. So we want to make sure that you're following with your dietitian, you're following with your providers, because this is a team effort. So we want to make sure that we understand how food works and how it's digested, because we need all sorts of foods to keep us healthy, but also to manage our blood sugars as well. So how does food impact our blood glucose? The left version of this picture, you can see this is a non-diabetic, digestion. We see that the food enters in, we break it apart, we turn it to glucose, and step number 4 is where we get into trouble with diabetes, where we either don't make enough insulin, insulin's not as effective, we have that insulin resistance going on. So that the right picture is really what happens as you digest food, that we're unable to process the amount of sugar and put it into the cell. That insulin acts as a key to put it into the cell so we can use it as energy. So we want to make sure that we are using food specifically to help slow down the digestion of our food, so that it's not just quick release of sugar causing an overload of sugar in our system, leading to a high blood sugar level. So we're going to talk about how each macronutrient in foods help to manage our blood glucose, because we do need each and every one. So why all macronutrients are essential. You might see, fad diets come out here and there. We talked about them last month. But all macronutrients are essential. You might see carbs aren't bad, fats are bad. No one ever says proteins are bad, but usually you'll see some fad diet come out to say eliminate, a total food group. We don't want to do that. Each macronutrient, there are only 3 for a reason, are important. They all work together to, 1, nourish you well, make your body function well, but they can all be used in the management of our diabetes too. So we see that carbs, they directly cause an increase of our blood sugar. They're supposed to. They're the body's main source of energy, our brain's preferred source. A lot of research shows that you need at least 130 grams of carb a day to function well. So obviously that need differs from person to person, just based on your metabolic makeup, but type matters. We want to talk about the type of carb, because while we say carbs, they raise our blood sugar, we want to focus on a specific type of carb to help manage our blood sugar. And those are complex carbs. So we talk about simple and complex carbs. Simple being high glycemic, fast digesting foods with not a lot of fiber, like white rice, white pasta, candies, cookies, cakes, chips, a lot of refined sugar items. They're not going to offer too much of a benefit for blood sugar wise. They're going to spike it really fast, which they're great for if you have a low, but for maintaining a stable blood sugar, they're not what we really want to focus the priority on. We want to go towards complex carbs, ones with a lot of fiber, really rich in nutrients, like whole grain rice usually has a couple grams of fiber in it. We've got whole grain pastas out there, higher protein pastas, which are nice. We've got fruits, we've got beans, legumes. Even if we do potatoes with the skin, we'll talk about portion sizing when it comes to carbs, but having higher fiber items are going to benefit us longer term in management if we're going to include our carbs regularly in our diet. So we need adequate, amounts of the carbohydrates to even absorb other macronutrients. That's why they're so important, because we need that energy. You might often find if you eliminate carbs all completely, you get that brain fog. You don't feel great. You might feel sluggish or tired. And that's usually because you're depriving and starving your brain of nutrients. So we want to make sure that we have a good, consistent amount, which we'll get into later, but having a good, consistent amount in your diet and focusing on a certain type of carbohydrate. We'll talk also about portion sizing and pairing. But first, we're going to go through protein. Protein, we know, is important because it helps with muscle mass maintenance as we're losing weight, as we're building muscle. But it's more complex, so it's really great for blood sugar to pair things together. We talk a lot about in counseling, pair your carbs with the protein, give them a friend. It slows down that digestion, right? You pair, if you have a piece of toast, you pair some peanut butter, you pair some turkey or something protein based on it, you're not as hungry as quickly. And that's because it's broken down much slower, which means the blood sugar release is much slower, which is what we want because it doesn't mean that blood sugar just spikes right up and stays in a high range. We get a gradual rise and hopefully a gradual fall. Fats do something similar as well. They slow down the digestion. They help us absorb nutrients. Like, right, you put that like a fatty salad dressing on your salad, you can absorb those nutrients better. And it keeps you fuller for longer. So having a carb, having a protein, having a fat at a meal is super important to maintain overall fullness and satiety, help maintain stable blood sugars overall. So we often always get asked, what should I eat? How much should I eat? And that is a very fair question. Normally our response as dietitians is all foods fit. Well, we won't tell you, most of the time, we won't tell you not to eat a certain food. We'll talk about ways you can eat some of those simple carbs that we mentioned in a safe way to manage your blood sugar. But we will say in general, all foods are okay. We want to try to avoid a restriction mindset because that often leads to binging behavior later on where, you give up carbs for, 2 weeks and then, it's probably unsustainable for most. So then you end up overdoing the carbs when you reintroduce them, and then you get higher blood sugars as a result. We want to try to include all foods, right, in a very balanced manner, which we talk about in counseling on how to incorporate those. But we want to allow ourselves to have a wide variety in our diet: fruits, vegetables, whole grains, lean proteins, good healthy fats. All of them work together to keep us and make us our healthiest selves. So we want to include a wide variety. We also don't want to spend too much time stressing over the food choices. We get a lot of panic when sometimes if you're newly diagnosed with diabetes, it can be really scary. What do I eat? I don't know what to eat. But limiting that stress is something we want to work on too, because that's going to elevate cortisol levels. It's going to elevate your blood sugars overall. So we want a very neutral perspective on food, knowing how it works in our body, knowing how we can eat even our favorite foods, right? Even candy that might raise your blood sugar. How do we incorporate that in a safe way? And it really comes down, we'll talk about the frequency, the portion size, the pairings, all those play a role in how your body will use it. Not to say we should be eating candy every day because that's not going to help the blood sugar, but including them in an occasional manner and something that you enjoy, living life to the fullest, right? We can do it in a safe manner while monitoring our blood sugar too. So those food pairings that I talked about, fiber, complex carbs, fruits and veggies that are rich in fiber, we want to make sure that we have something on our plate that has that fiber, that has that protein to slow down the digestion the best we can. So what we talk about in medical nutrition therapy is consistent carb diet. So there's a misconception that you need to cut out all carbs when you find out you have diabetes. Sure, it could help maintain blood sugars, but we also know that lack of carbs can make blood sugars go a little wonky too. You might have dips in blood sugars that drop really low if you're excluding all carbs, especially on certain medications. So we want to make sure that we have consistency in the amount of carb you're eating. For example, you could get all your carbs at dinner, eating a big spaghetti meal, right? You check your blood sugar 2 hours after, it's probably really high. But if you spread out that intake through the day, maybe you have half a cup of oatmeal in the morning, maybe you have a whole grain roll at lunch, maybe at dinner time you have a baked potato, right? You've got a consistent spread out of carbs paired with protein, paired with fiber and other items at the mealtime so that you don't get a quick fuel rush of sugar. You're not overloading your system at one time, but rather you're spreading it out through the day. Then it's also important to check your sugars regularly. Everybody is sensitive to specific foods. I've seen one person who gets really high blood sugars with apples, one person with pears. They can eat, other fruits and be fine. We talk about your specific needs because it can be very individualized, right? Checking your sugars regularly help us form a game plan on how sensitive you are to certain foods. I know some people who can't eat pasta very regularly, or some people who can't eat white rice very regularly because they know what it does to their sugars. So then we get to strategize. What can we add to that meal? How can we change the carb source to better benefit you, yet still keep you satisfied at a meal? And that comes into portion sizing. So we really want to make sure that we have, when we have carbohydrates, we want to make sure we portion size it and have a good ratio comparatively to the other items on our plate. So half a plate of vegetables, a fourth a plate of protein, fourth a plate of carb is just a general guideline. Everybody's going to need a little bit something different, right? If you're working on gaining muscle, we might increase that protein. If your sugars are really, really sensitive and really fickle, we want to make sure we maybe decrease the carb a little bit, increase protein and fiber. We can play around with it because it is individualized, but this is just a general guideline that we use to prioritize those veggies and high fiber items, have a protein source, and then use that carb as a supporting player to help keep you full, to give you that extra energy that you do need. Then we also get asked, does timing of meals matter? It can be pretty important in balancing sugars. We know just like a consistent carb diet, spreading out a meal or snack intake throughout the day distributes the glucose over a longer period of time, which means we don't normally or shouldn't get too big of spikes. So that's our goal in kind of spreading out the meal and snack intake through the day. Smaller, more frequent meals also keep the metabolism running really well. You're reminding yourself that you're getting consistent intake, especially on those weight loss medications. And even if you're taking Ozempic for diabetes management, you might not feel hungry, but we want to try to get you to eat regular, frequent meals, because if for some reason you come off that medication, you might feel that hunger return. And we want your body to be used to getting that regular nutrients, making sure that we're not losing muscle mass while we're losing weight. So we want to make sure we're spreading out small, frequent meals, snacks in a way that fits you, which usually we dive in during counseling to talk about what fits your specific needs, your specific schedule, and form goals for that. We also make sure we don't want to skip meals. So, right, if you're not feeling hungry, we want to make sure we have something included during your day, breakfast, lunch, dinner, snacks, whatever works for you timing wise. But we don't want to go more than 3 to 4 hours without eating, because that can make the blood sugar either drop or it can make it go up in some cases for your liver, which sometimes compensates by adding extra sugar into the bloodstream as you break down glucose stores. So we want to make sure that you have frequent meals. We don't want skipping because it could, even give you a dangerous low, which that's a preventive measure of having consistency in your meal intake. And like I said, everybody's different. So paying attention to how your blood glucose reacts personally to every food. Blood sugar measurements are a tool of education for us. It helps us identify how you're responding. Can we change anything? Can we alter meal times to better serve you, right? If you wake up with a high blood glucose, maybe for breakfast, we're going to focus on protein and fiber rather than prioritizing the carbohydrate. So that gives us some more information to help better suit your needs for what is the best diet for you. And then are there other factors that can improve our blood glucose? Absolutely. There are 40 things out there that impact your glucose. And these are just the behavior ones that help. So hydration dilutes the bloodstream, keeps our blood sugars more stable. We know that dehydration, we can have higher blood sugars. Vice versa, we want to make sure that if our sugars are elevated, we want to stay hydrated as well. So hydration plays a role. Stress, we talked about, can increase your cortisol levels, which means blood sugar goes up, the adrenaline goes up. So stress management, practicing relaxation is all part of managing your sugars too. Sleep as well, you might notice, like if you sleep poorly, even like sleep apnea can affect your blood sugar levels. So practicing good sleep hygiene, right? Making sure you monitor your sugars if maybe your sleep was a little off this week. And then of course, exercise. Our body loves moving. So if your body is more sensitive to that insulin, right? It can make insulin more receptive in some cases, which allows us to take up that sugar and put it in our body for energy. So our goal is to have a joyful movement that you stay consistent with, right? It's not helpful if you go to the gym once a month, right? I mean, maybe you get a good workout in, but the consistency, even 5-minute walks after meals have shown to reduce the blood sugar immensely. So having a regular pattern of movement in your day is going to be very beneficial for blood sugar management. It can even take effect 6 to 12 hours after you move. So monitor your sugars regularly, make sure that you're not getting any lows before, after, during exercise, and include regular consistent movement just to help balance out that blood sugar. So just a summary, your food impacts your blood glucose levels. There's no denying it. We can see directly if you take your blood sugar after eating that your food is going to impact your journey. But all foods are important to maintain health and a stable blood sugar. So each macronutrient, each food group plays a role. And we want to make sure that, if the food group raises our sugars more than others, that we do it in a safe way, that we include those foods with protein, with fiber, with really nice portion sizing efforts. The frequency of eating as well, right? We don't want to eat like a lot of carbohydrates too close together, because that's going to result in a higher blood sugar more than likely. And then get to know your blood sugar patterns, take your sugars regularly, have discussions with your doctors about, I'm more sensitive at this time during the day. And the more you know about yourself and your blood sugar, the better we can form a plan for blood sugar management for you. And there's so many factors that impact your blood glucose. So we want to make sure that we find balance, right? We we know that, there are many measures of health, and behavior change is very helpful in managing health issues, chronic issues, diabetes, blood sugars. So we want to make sure that we stay with our preventative care. We follow up with our providers, talk about things we might be struggling with, because small adjustments can make a huge, huge difference in your blood sugar. That's it.
All right. Well, thank you, Caroline, and thank you again, Dr. Hundal. So as I was listening, the presentation, one of the really important thing, also because I'm part of the bariatric program, one of the expectations that we see most patients is that anything that we present or provide as a solution, if these are like the magical tools, and the truth is that's not the case. These are tools effective, but only if they are being used in a way that the physician prescribe these, and then there's a nutritionist support, and then you change your lifestyle and making sure that you increase your activity level, and you still watch. So these are not like, you're not going to take, Dr. Handel, maybe you should work on that, and maybe that I'll be your, guinea pig. Just give us a medication, and then I'll take one, and then 2 weeks later I'll lose 30 pounds. But this is not real, right? So that's what I'm trying to say. But if we had one, we would be all taking it, I promise you. But there's no such thing. So this is, we do our best with our physicians and the other teams to make sure that these are given properly. And, one of the other issue that I see, again, like the physicians, they are giving these medications, but there's no nutritionist order. So without the dietitian and nutritionist on board, it's difficult to deal with obesity and morbid obesity. Dr. Handal, do you get the same type of misperceptions from the patients in terms of what their expectation is?
Yeah, usually we now these two drugs are specifically Wegovy and Zepbound. They have been designated as weight loss medication. But when we were prescribing Ozempic, other drugs, I usually use the weight loss at the back end, not as the first, bringing it as the first one. Because initially, as you say that, as you mentioned earlier, not everyone is compliant with their diet and exercise.
Right.
So if you tell them, oh, this is going to make you lose weight, they forget about everything else. Like, it's going to help my blood sugars, will help my heart or the kidneys. And in real life, not everyone loses weight. So they come back and then they tell you, oh, I stopped the medication after some time since it was not helping me to lose weight. So it's very, very important to first focus on the main indication. But when you're using the Wegovy and the Zepbound for weight loss, I clearly tell them, initially, these drugs will help you, especially in someone who are binge eaters. So they eat a lot, you put them on these medication, suddenly their appetite is down. Yes, anyone in that way will lose weight. But ultimately, the body is trying to fight the weight loss. You will hit a plateau where it becomes very difficult to go further down. So that's where your nutritional counseling, exercise is going to play a role. But there are other people where the weight loss, they may not experience that much weight loss if to start with, they were not eating too much. So they don't expect 20% weight loss in those individuals that they were already doing very good to start with. Right. So it's variable. That's why these studies, you see a varying degree of weight loss. And in clinical practice, we also see the same thing.
And having like frequent physician follow-ups, provider follow-ups is also important. So with the case conferences, Dr. Handal, what I see, and in both of the case conferences, they start and then they stop the medication. And then sometimes when we send you patients for diabetes management from the weight loss program, patient use a couple of medications, they stopped 7 months ago. Now their A1C is 9, 12.
Right.
It's just so clear that they stopped the treatment. So maybe they were expecting differently, and this is why it's kind of important because these are very costly drugs. That's the other thing.
Yeah, very expensive.
Extremely costly. It can be anywhere from $1,200 to $2,500 a month. So that's why when you are using it, you want to make sure that you follow your provider's, physician's orders and work with nutritionists. And I urge our primary cares everywhere, not just with United Medical, but everywhere, to emphasize these because we want to set the expectation correctly so then they're not disappointed later on. So, well, thank you for both. As an accredited diabetes center, United Medical ACO takes its role extremely seriously, and our commitment for providing the highest standard of care and education for our patients. So this is our clinical presentations for that. I again thank Dr. Hundal for taking time off from his office hours, and Caroline, of course. Thank you, and we'll be back with another event later on. Thank you so much again.
Thank you.
All right. Take care.
Bye-bye.
Bye-bye.